I'm Brenda Sabolas, and I hope that as I talk to you about stigma, I hope that we end my brief presentation with two outcomes from you. One is that you question your own beliefs about mental illness, and that secondly, you determine a few steps that you will take to support the debunking of stigma. Okay. I'm going to ask you these two questions first. These are about your beliefs. Do you believe, can treatment help people with mental illness lead normal lives? Okay. Are people generally caring and sympathetic to people with mental illness? Okay. Wow, I'm going to show you some Georgia information, and I think you just confirmed it by your answers. There are several different types, can you change it? Several different types of stigma that are really, really important for you to understand. Because these different types of stigma impact not only the individual, but they impact the public and the institutions and the sense of community that we have. I was really heartened by our first introductory panel today, where the question was posed, how do we change our communities? And then there was a second reflection on getting to the heart of violence. And while people with mental illness, as you have heard and as you probably already know, only a very small percentage of people with mental illness commit these crimes, there still is a disproportionate amount of stigma regarding mental illness and violence. So self-stigma really is about the stigma that people who are experiencing symptoms tell themselves. And it varies from ages. I mean, you have ages, children, 18 to 25, adults, you have elders. And when you think about these different groups, you think about the youth who have certain impressions of youth committing violent crimes, gangs, all of that, all the way to the elderly or our parents who we wonder, why won't they get help? We think that, depression or slowness might just be a part of aging. All of these are stigmatizing thoughts. So with self-stigma, and there are some quotes here that you can read for yourself, but the issues with self-stigma are that it impacts whether somebody will seek access to services. Sometimes people think that if people know that they have these symptoms, that they will be judged as incompetent, incapacitated. They will be marginalized, put aside. They are afraid. They are afraid that their issues will not be kept confidential. So they won't seek treatment, or they won't seek adequate treatment by the level of professional that they need. Public stigma. This is where the general public already has a story in their minds about people who have anything from affective illness all the way to psychotic illness. Now, many of you know, if you've ever heard Dr. Satcher speak or you've read the literature, at this point in time, 1 in 4 Americans will have a diagnosable mental illness, and that includes addictive disease, sometime in their lifetime. 1 in 4. Look around, people in this room. This includes everybody, no matter where or what you do work-wise, where you live. Think about your family and friends. I think it would be hard set to identify anybody in this room who does not know someone, have a family member, or has not experienced symptoms of some type of distress or diagnosable mental disorder. Okay, next slide, please. I do want to mention, though, the institutional stigma. And the institutional stigma are things like, how do the legislators assign funding? How do the payers out there pay for addiction treatment or mental illness treatment? We all know that finally Obama has commanded the fact, President Obama has commanded the fact that addiction and behavioral health must be covered. That's huge. We already know that he has commanded that the NIH and the NIMH has a whole decade of brain research. That's huge. These will finally contribute to the fact that these biological illnesses, genetic illnesses, these experiential issues that people have really are on the same level with other disease models. So, the questions that I asked you were really part of the behavioral risk factor surveillance system study that has been done in the past couple years. The CDC has this surveillance system, and they coupled with SAMHSA to add a stigma model. So the only points I'm going to run through these really pretty quickly is that when they look nationally at the statement, treatment can help people with mental illness lead normal lives, you can see on the right, agree slightly, agree strongly, strongly, overwhelmingly, people agreed with that. Next slide, please. However, when they asked, people are generally caring and sympathetic to people with mental illness, you can see that the perceptions varied widely. There's not really a predominance of any column having any significant level of agreement. Next slide, please. And so when you focus on Georgia, and this was done in 2009 in Georgia, what you can see, and I don't know if you I hope you can see, in that second section, on average, when they look at that second section, which is ages, third section is gender, fourth section is culture, on average, the younger the respondent, the more likely they were to disagree. That is disheartening, because children come up with their own perceptions and then they also learn from their parents and family. Also, when you look culturally at these groups, the Hispanic respondents are more than twice as likely to disagree compared to other groups. Part of the reason they pull out age, culture, gender is because they use this information to target public messages and public education so that they would know who to address first and what kind of materials to create. Next slide. This is in regards to the total disagreement that people are caring and sympathetic to people with mental illness. What we see with that is that the youth and women, more women than men, disagreed that people are caring and sympathetic. That's disheartening as well. Next slide. This is an important slide because essentially they went ahead and polled groups to identify people who had serious psychological distress. That is where they have had a series of 6 pertinent symptoms over the past 30 days. Frequent mental distress, which was also a 30-day evaluation of distress, and also those receiving treatment for a mental health problem. And what was clear from this in Georgia is that adults experiencing distress or receiving treatment in Georgia disagreed more strongly than other respondents. So they're not feeling it. They are not feeling, as we said earlier, they're not feeling the love. They're not feeling the community support. Next slide, please. So finally, what I want to identify for you are targeted interventions that are really important in regards to addressing stigma. One is education, to create the perceptions and the barriers that are all around us. We have to ensure that people have access to appropriate levels of care, which means we have to be informative to our legislators. We have to know what services are available in our communities. These are important because of the fact that we have to be able to ensure in our communities primary prevention, which is essentially getting there before illnesses start. There's a lot of work with prodrome and early first episode psychosis with children, since we've talked a lot about youth. It's important to know about these issues so that people can be attentive in the communities when children are exhibiting disorganized behaviors, isolation, failing grades. At times we think, oh, that's just young adults. Well, it's not in many cases. That's the time to intervene. So we need to have these abilities in the schools, in the pediatric offices, everywhere for prevention, for secondary, which is actual early diagnosis, and then for tertiary, which is managing these illnesses. Empowerment. We have a lot of client empowerment. A lot of advocacy groups are out there, and we need to make room to be able to hear the voices of people who have gone through this, families who are facing this, and people who are in recovery. We need to enhance our sense of community, period. There are all types of people, all types of illnesses people are going through. We need to be able to support them in our communities. And finally, we need to evidence recovery broadly, whether it's through TV messages, whether we support different programs, whether we protest when people are depicted in certain ways, because stigma is a killer.